Auzu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. I start the CME update by the Mother and Child Survival Group of Pakistan. Me, Dr. Tariq, Ops Gynae Family Emergency Specialist, internist, Gulf KSA, presently a district gynecologist. A brief scenario I want to discuss with you about a 15-year-old sexually active girl want to ask from you about the use of oral contraceptives. What are the options available? So for that you have to see the girl scenario as at what age, what are the legal implications, and regarding her age and regarding her Fraser competence. Either she should take her parents into confidence or not. That issue also has to be discussed. And most important are the legal aspect as well as the age as well as the Fraser competence. She is asking about the use of oral contraceptive pills. Her educational status, her financial status, and her family background, that has to be taken into consideration. And for that you have to take her medical, gynecological, obstetric, and her gynecological and her medical, sexual and family history in details. Also for an gynecological history, her smear history and regularity of the menstrual cycle, regular, irregular or erratic, or her menarche, and also her need for about the gynecological history, most important smear history, and any need for any availability of this fibroid and the cervical polyp, and about the quality of discharge, any signs of vulval itching, burning, and also it is important to assess the need for emergency contraceptions, and also about the sexually transmitted diseases. For about the asking about any previous record of ultrasound for fibroids, irregular bleeding, menorrhagia, polyps, and dysmenorrhea. All these are relevant, important points to be asked for. And then we have to see in details about the medical, family, surgical history, her about the use of her as a smoker, or alcohol, or any drug abuse, or any sexual abuse or child abuse history. These are important, relevant points, and asking for assessing the need for putting her on oral contraceptives. Then we have to see the blood pressure, BMI, weight, and also her, as I have asked about smoking and alcohol intake, though less likely, but smoking is very important as it increases the cardiovascular and stroke risks and other things and STIs and STDs in the future. And then these BMI, blood pressure, and as medical sexual obstetrics, gynecological history, smear history, and all these. Then assessing her age, the Fraser competence, and a need for emergency contraception, and these things. These are the things which are we looking for. And then after counseling her about the pros and cons and the risks of the oral contraceptives and the methods available are oral combined pills, and the asking about their details, the progestogens, the naturally she is sexually active, so these are the options. The other options are the progestogens, long acting one, and tablets as well, and then the implanons. The progesterone or estrogen depot preparations, intrauterine system, and all this. But for her, considering her age, this she can be explained about the risk and the side effects. What are the side effects? And the side effects are of these pills are nausea, vomiting, breast tenderness, heaviness, and fatigue, migraines, and erratic bleedings, amenorrhea, irregular bleeding, and all headaches, and depression, acne, and wrist aches, pains, tenderness, all these, and dyspepsia. These are the minimal side effects of the oral contraceptives, both estrogen and progesterones. So she need to know about all these. So for her age, these you have to consider the risk and the benefits. So for her age, these are the good options available, and she could choose. She could be asked and take